So can we go back a little bit and can you tell me what happened, like, how did this diagnosis get made? I know you see Dr. Webster like every 6 months, correct?
Oh,
No, once a year,
once a year.
Okay,
In, the beginning of,
December,
November.
November, okay?
was that, yeah, in the beginning of November, I had this thing.
In like the left upper back here,
Center.
Yeah, right.
center back, okay?
Center back, and I tried to get an appointment.
What,
Well,
you
I
noticed a
waited.
lesion, like something growing?
Yeah, I really didn't discover it that well, really realize it might be something because I have things all over me
Sure.
until December, and sometime before Christmas, I called them for an appointment, and he couldn't see me until January 29th, today,
Okay,
and Gwen, who I actually prefer, but she couldn't see me until February,
okay.
and it was getting bigger and bigger.
Do you have a picture or anything for me to
No,
see?
no.
I don't still have a picture.
No,
Okay.
she
It
never
was
had
like a mushroom, and then
And
it was
growing,
red.
it was growing like out of the
Yes,
skin, right?
yes.
Not going in, but growing
No,
out, right?
growing out,
Okay,
and,
Shaped like a mushroom, had a little
Yeah.
stem and then a
got
bulb
it,
on the top.
got it.
and then, so we were nearby, so we stopped in the office one day, whenever it was, a week or so ago,
Yeah,
and, to ask if we could move the appointment up, and he took me right then and did it.
and
Biopsy.
and he removed it, right?
Right, and he said it, thought it looked fine, but he had to send it for a biopsy, and
Okay.
of course it wasn't.
And that showed the nodular melanoma.
Yes,
It was quite big in size, about, okay.
Eight,
8.1 millimeter in thickness. Now, that's to be questioned because it was not deep into the skin, it was
Up.
up,
Not
up,
over.
so
Good.
how to measure it, so we had to figure that out, okay? So then you ended up seeing Dr. McRae, correct?
correct,
So he referred you to see Dr. McRae, correct? Dr. Julia McRae?
yes,
Dr. Webster recommended it.
Yes, got it.
Yes.
And so then she ended up doing, she resected this, right, to take a deeper margin and did the sentinel lymph node biopsy on the left side, right, on the left neck.
I did 3 nodes.
3 nodes, left and right both.
And
Yeah.
something about a chest. I think she
Two
said
were
2
close.
necks and a chest, is what she
Okay.
said.
2 were close together
two
on
were
one
very
side.
close.
Yes, I saw that on the,
Very
Okay.
close together, and then
And
the
when-
other was on the other side. I
Got
think
it.
these are the close together,
Got it.
because it's a bigger
okay,
thing.
so that surgery was done on Monday,
Yes,
and now you're here to figure out what next step.
yes.
Got it, okay. Now, how are you doing otherwise? Like, otherwise you're feeling okay?
No, you having diarrhea constantly.
No, I've had diarrhea starting
In November.
in November. I, took antibiotics, and how did I end up on them for 10 days?
She had a bad tooth that had
Oh,
to be
right.
removed,
In October or something?
and they put her on antibiotics for the pain and the infection, and then her appointment got delayed, so she stayed on the antibiotic for an extra 3 or 4 days, and so she wound up on this antibiotic for 10 days,
Got it.
and it's actually one that she's allergic to.
Most, yeah,
Was
most
it
antibiotics
amoxicillin
don't
or
agree with me.
Amoxicillin or
Which one was it?
augmented amoxicillin? Okay, never mind, that was in
It was
October,
a
right?
common type.
So anyway,
Yes.
she got, and then she got diarrhea.
Since November?
Yes, and she's had diarrhea since
And then
November.
they put me on an antibiotic because they thought I had C. diff.
Okay,
Which-
did they confirm C. diff?
No,
Okay,
and I didn't have any of the other side effects, so
Symptoms.
we're thinking, symptoms, we're thinking maybe, probably not, but we're not sure. And, so then they put me on another antibiotic, which gave me the diarrhea again,
okay.
and then I've been fighting it.
Well, the antibiotic they put her on was the one that kills the
C.
bad
diff.
bacteria in
The
the
C. diff,
system.
yeah.
Yep.
The C. diff stuff.
Was it a
Kill that.
liquid medicine, vancomycin, or was it Flagyl?
It was Flagyl.
Flagyl, okay. So that was the second time. And
That
then
was
they
the
gave-
second antibiotic to
And
kill the
that
bad
gave me,
germs.
and that,
And she had, like,
gave me
she had
diarrhea
diarrhea
again.
the whole time through all of that.
And you're still
Yes.
having it?
occasionally, nothing
So
like
it has
that.
gotten better?
It's got much better, but it's not totally over.
Okay. Are
5
you
times
taking
this
any-
morning.
Yeah, I had
5
some
times this morning, so.
And is it loose or liquid or like,
It depends. This morning it was just liquid because
Okay.
I hardly have anything in me.
Okay.
I tried not to eat so I wouldn't
Okay.
get
She
it.
was cleared up for about 3 weeks,
Yeah,
I
I
would
was
say,
fine
and
for
then
several
this
weeks.
past week, Monday it was one day, and yesterday and today she's had diarrhea, like
Okay.
4,
Flare
5,
up.
6
And
times
I
a day.
do get it when my whole life, I have
When
never
you're
been
like stressed or
constipated
something.
my whole life. I always
it's a
got
good thing.
diarrhea if I
Fine.
was upset about stuff, so.
And you went through the operation. So.
Right,
Are you taking any probiotics?
sometimes.
Those gummies, she forgets to
Well,
take
they
them.
gave me probiotics before the surgery. Yeah, there was
It may
a
just
probiotic.
help because the gut, like in the GI tract, all the bacteria are really important, and probably with the antibiotics you
So
took,
sh-
like it
Should
may
I be
help with the
taking
diarrhea.
probi-
This word it's
I
not gonna
take
have any harm.
antibiotics, they're gummies.
No,
No,
probiotics.
probiotics, not antibiotics.
Probiotics, they're gummies,
Okay.
and so I take them, so
Sometimes I do.
she could take what I'm taking.
Yeah, sure.
And she
Okay.
forgets to
Okay.
take them most of the time.
I did for a while
She
once.
did.
Okay. So besides the diarrhea, anything else bothering you? You're otherwise feeling okay, active.
Well, I haven't been active, I've been exhausted, I've lost almost 20 pounds
Because
with
of
the
the diet.
diarrhea.
Okay.
Some days I feel okay, other days, I feel much better these last days than I did in the beginning. I
Right.
have good days.
Okay.
And she has peripheral artery disease, and she gets pains in her legs, kind of severe pains in her legs at
At
night.
night, I get
So
cramps
she's
in my
always up,
legs.
screaming and yelling with pain, and then I put biofreeze on it, or,
Hot
This
choke.
is peripheral arterial disease, you said.
excuse me?
You mentioned she has peripheral arterial disease,
Yes.
right? Okay. And who manages that? Dr. Harrod?
Yes.
Right. But he
Okay.
seems to think I'm
But he
good.
says you have the disease there, yeah?
I know, he says but I looked it up and it said like minor or something and from the original, and then last time he just said I didn't have to see him for 2 years, but
The pain
I'm
is still
suffering.
there. Okay.
Something's wrong.
Okay. How about cough or chest pain or shortness of breath?
No, I'm not shortness of breath. I get pain in all, like I get pain here, but I get the same pain. I get lots of, from arthritis, I have pains every place I touch almost.
And you have like just osteoarthritis or
Rheumatoid, I think,
Rheumatoid.
isn't it rheumatoid?
I don't know what,
I
I don't
thought it
think
was
it's ever been tested, I
rheumatoid.
don't know what you
I
have.
definitely, it's gotten worse. In fact, we were gonna have it more checked and then this happened.
got it. Okay.
But my leg, everything, all my joints,
Okay.
She's had very minimal activity or anything in months.
yes,
Okay. Because of everything that
Everything.
because of everything.
and
Yes.
do you get pain in the legs when you walk, like a short distance, you get pain, or just at night?
It's just, I used to get some pain, but no, it's at night. It's at
Well,
night.
that's what, Terry,
Doing
but
nothing.
that's what prevents you from walking any distance, your leg hurts first before your
Right.
back hurts,
Yes.
usually.
And that's probably from
She
the
walks a
peripheral.
distance and then we have to stop
Yeah.
because her
Yeah.
legs
Yeah.
hurt
Yeah.
before her back, because her back also hurts.
And
so-
that's the
Yeah.
classic symptom of peripheral arterial
Okay.
disease. When you walk, that pain happens. So,
Yes, but
okay, got it.
I mean, it doesn't happen much lately because I haven't been doing
Right.
much, but the
Yeah.
nighttime one is
Yeah.
terrible.
Okay. In terms of other medical history of high cholesterol, correct? History of AFib or heart disease or anything like that?
I used to have a heart murmur. Do I still even have it?
The last
I'm
time
not
they
sure.
tested you in the hospital, it didn't.
They said I didn't, but
Okay.
I always did, so who knows?
History of high blood pressure, diabetes,
High
No
blood pressure.
diabetes.
No diabetes.
high blood pressure. Okay. No, never had any heart stent or anything like that,
No.
right? Any liver issues or kidney issues?
No.
No. And osteoarthritis, osteopenia. That you have history of osteoporosis or osteopenia? Do you remember?
She has no idea, I don't think she's ever
Okay,
been
no worries.
tested.
Don't worry. Okay, got it.
I don't know the difference, so I can't even tell
Don't
you.
worry. Okay. In terms of your operations, you have had tonsils removed, hysterectomy. Both the knees were replaced, correct?
Yes,
Which hip was replaced, right? Or
My right.
Right. Okay. And then you had the operation with Dr. Harrod for the peripheral. What did he do? Did he put a stent?
And that
or?
was, that was a different doctor, that was
Schickler.
Schickler?
Schickler, yeah.
They went in and did the balloon thing,
They
And they didn't
tried
put
to
a
open up the vessel,
with a balloon, that didn't put a
balloon
stent.
angioplasty, okay.
Yeah, that didn't.
On
work.
both sides?
Oh, just the
No,
one
just the
side.
one.
Okay, got it.
And don't ask me which side, I don't remember.
That's fine. And you had the melanoma operation right now. Okay, okay. And 2 children?
Yes.
Daughter, of course. And
Two daughters.
Another
Two
daughter.
daughters. Okay. Did both of them live close by?
Yeah, well, we're.
45 minutes, yes.
It's close enough.
Yeah.
Okay. Any family history of cancer?
Yes,
Looks like your mother had cervical cancer, but probably cured from it.
Oh, yeah.
yes, and uncle, both of her uncles had cancer, no,
Okay.
one uncle had cancer, I'm sorry.
Okay, got it.
Yeah, no.
And you are up to date with all the screening. You had mammogram in 2023. Colonoscopy was 2013, a while ago. That's fine. Okay, no smoking, some alcohol, occasionally, correct?
Right, and I haven't had any alcohol in.
Okay, that's fine.
Through all this,
And retired, correct? And what did
Yes.
you? What kind of work did you do before?
I worked for a financial planner.
Okay, great.
I was
Okay.
assistant,
And how long have you both been married for?
55 years.
55 years.
Great.
And we've known each other for
74 years.
75 years.
Wow.
We were
So, like-
neighbors
So
growing
like,
up.
since you've been known since you were 2 or 3 years old, is that what
Yeah.
you're
Yeah.
saying?
Yeah.
Amazing. Okay. Okay. Now, see, the most important thing will be really what the final pathology is going to tell us. You know, see, when we stage any cancer, we look at something called as TNM staging. And TNM staging stands for tumor stage, lymph nodes, and metastases, okay?
Mhm.
Now, tumor stage is usually from T1 to T4, and in some cancers we look at the size of the tumor, in some we look at the depth of the tumor. So in melanoma we look at the depth. Now when you look at the pathology report from the biopsy that was done, they reported it to be like quite deep, 8.1 millimeter. But remember, this is the depth going into the skin. This was a lesion coming outside. So I will have to clarify with the pathologist, is that a true measure of the depth, or is that not considered as T4 lesion, because that changes your management completely.
I'm sure.
So we'll clarify that, okay? Right?
So we don't know the depth.
Yeah, so let's say we call it as T4, okay?
Okay.
Let's say we say this is the correct way to classify it, okay? Then the next important thing becomes is what is the status of the lymph nodes? And that's why this biopsy result will be important. It's not back yet, it will be back, few days from now. Now let's say this is negative N0, then this would still be, probably stage 2 melanoma, but on the aggressive side, because it's T4 lesion, and there may be some role of doing immunotherapy treatment once we have all the pieces solved, okay, all the pieces of the puzzle put together. And we'll meet back again to go over all that, because I don't want to, jump to conclusion today. So that's a possibility. Now let's say that the lymph nodes are positive, okay?
Mhm.
Then regardless of what this T stage is, that will drive the decision making, because that makes it stage 3 melanoma, okay? Alright? And in that situation, you definitely will benefit from immunotherapy, but again, let's wait to finally get the final pathology, okay? The big important question is, should we go ahead and do a PET scan for you while we are waiting for this pathology to come back? Because metastases is, if the cancer has spread somewhere else, and the best test to do that is a PET scan. I think in my mind it's reasonable to go ahead and order this today. I don't think anyone has ordered it, right?
No, correct.
So that by the time you come back, we have the PET scan result, we have the pathology back, so we can make a final decision, okay? We don't have to decide today, because it's still, waiting 2 or 3 weeks is not going to make any big difference, but we want to make sure that's the right decision for you.
Could it also be stage 4?
So that's why I'm doing the PET scan.
Oh, okay.
Okay, so I'm going to order it today for you, okay? So the purpose of today's meeting was to kind of explain what this is, get the PET scan ordered, get some blood work ordered, and then meet back in about 2-3 weeks to go over everything and figure out a plan. Okay?
Does it take that long to get the PET scan results back? Because she should have the results from the,
Next week sometime. I think it's just
Okay.
a matter of getting it scheduled, the PET scan.
okay,
Okay, because I'm seeing the doctor next week, the surgeon.
just
Yeah.
to have, just to check your wounds, not for,
Yeah, but I
Anything
think
for
by the
cancer.
time I order, it won't get
Okay.
it won't get scheduled so quickly.
No,
That's
but
the
she
problem.
said she'd have results of what they did
yes,
Yeah, that
tested
should be
during the
back next
surgery.
week.
yes,
Yep.
yes.
Yeah.
So is the PET scan done here?
Either it can be done in this this building, or at the hospital, or at Delaware Imaging, wherever she can get it in. The
So
next
wherever
one.
you can schedule.
Yeah, wherever I will put the order in. Okay.
And the results of that takes 4 or 5 days again to get the.
Yeah, it depends. Sometimes it's faster because the radiology read comes faster. It's just a matter of when it gets scheduled. So I'll schedule a follow-up with me today before you leave.
Okay.
I'll give 3 weeks time to schedule, assuming that's enough time for everything to get done. And what I'm saying is, even if we wait till then, it's not going to make a difference in her treatment, because a few days here and there doesn't make a difference.
But
Okay.
there will definitely be treatment.
I'm not yet sure.
Oh, okay.
Say if the lymph node is negative and we don't classify this as T4, we'll clarify that. And it says it's only T1 or T2 with N0, then you may not need any treatment.
Oh, okay.
But it was a fast growing lesion, that's our concern, because it happened within like 2 months from what you are describing.
Oh, this,
And because any treatment we do has its own side effects, so like immunotherapy generally is well tolerated but can have significant side effects. So let's be sure you need it before I go into the side effects, okay?
Right. No, I understand. I was just
Sorry,
trying to get,
I think you were asking
whether
something.
we're going to Florida.
yes,
That's in
I
March.
say this 8 millimeter thickness. Will the surgery they just did Monday help determine how thick it went down?
No, I'm going to talk to the pathologist who read this, because I don't know what clinical history they got. I'm going to try and see if I can talk to the pathologist. But she did go down to cut more tissue, so that will give us an answer. The
What
depth.
you just got done?
Yes.
How deep it is?
Yes.
Into the skin?
Yeah.
So it could be, everything goes well, it could have been 8 millimeters thick all up.
Yes,
And like nothing going down.
it could be.
Good, that'd be hoping for the best, but yeah.
Yes, yes.
right.
But again, how do we then account that 8 millimeter is what I need to
Right.
figure that out.
Did they include the mushroom part or not?
That make sense what I'm saying?
Yeah.
Okay, nothing straightforward in life, so it's
No,
not black on white.
I
So
know.
always these
Especially
gray
at
zones
this
that are
point.
harder to make decisions, but I think, if the lymph node is positive, then we have a clear answer. Right, if the lymph node is positive, we definitely are going to do treatment for her. The lymph node is negative, then that is very critical. Assuming the PET scan is negative too, which I hope it is going to be negative. Okay?
So in 3 weeks, what is that, February 14th or something
Yeah, week
around
of
there?
that. Yeah, I'll schedule.
Yeah, how quickly would, treatment start?
We can start the next week if needed, the week after that. It's
So once you
given.
get all the results in, you can start in the next
Yeah.
week.
How long is treatment normally?
So normally if we end up doing treatment, we would give you, if it's adjuvant treatment, means the PET scan is negative, then it would be usually a drug called Keytruda. And that's given once every 3 weeks for about 1 year, okay? Each
Wow.
treatment takes 30 minutes, not too long.
So she comes here for these.
Yeah, it's very easy to tolerate.
And that's different than chemotherapy.
Yeah, this is immunotherapy.
I mean,
Okay. There is also additional testing that we may do on this tissue that's called as next generation sequencing, which is basically looking at gene sequencing on the melanoma itself, because there is a specific mutation that some melanoma patients have called BRAF mutation, and if that is present, you can sometimes give pills, but general recommendation would be to do immunotherapy. It's an antibody drug, not chemotherapy,
Mhm.
but has to be given IV, given once every 3 weeks for 1 year. generally
Give it
well
similar to chemotherapy as far as,
Pardon me?
I mean, the way it's administered, it's similar to chemotherapy.
Yeah, just an infusion, but it's an antibody product.
Yeah.
It's been, I mean, it was first approved, immunotherapy was first approved in melanoma back in 2013. It has changed the whole approach to cancer treatment.
That's what Diane had when she had skin cancer. Diane did the immunotherapy.
Yeah, used in,
That's
yeah, I mean,
just-
used in other skin
Fluorescent?
cancers too. I mean, melanoma is a skin cancer, right? But other skin cancers also you can use it. Squamous cell cancer.
Yeah, she had.
Squamous cell.
No, she had melanoma. Mhm.
Okay. Okay. And then you will continue to need to get skin exams every 3 to 6 months initially. All of you should get it, you know, for sure.
Well, she goes,
just did.
she sees the doctor again in March, I think.
Yeah.
And mine's in April or
Okay,
something.
good.
I just went 2 weeks ago.
Okay.
Yeah, we've been going every year.
Oh, we
Yeah.
don't change.
Yeah, well, you
Especially
probably have to go
Doctors,
every
because
other
we
day
had
now.
trouble getting to
Yeah.
see him.
Okay. Does this make sense what I'm saying so far?
Yes.
Any questions? Okay. Thanks for your patience. Sorry to keep you guys waiting. Frank and
No problem.
Okay, can I examine you? Now the important part two for me. Is it okay? Should I give you a gown or what do you prefer? I just want to check your skin. You know, you can leave your bra on, but do you want me to give you a
Are you
gown?
wearing your full body?
Yeah. I
Yeah,
wear
but should
all in one thing.
Like a,
He'll-
almost
he'll-
looks like a swimsuit. A one-piece swimsuit is what it looks like. So I don't know if you're gonna be able to see anything.
Oh, okay.
Well,
No, you
can
see the back and the
you can
legs.
see
Okay.
my
That's
back.
fine.
Okay.
Yeah. You want me to give you a gown or?
Stand up.
Take the glass off.
Just, yeah.
So I'll be right back. Okay, I'm going to
Okay.
get my medical assistant.
Ooh, the seat's warm.